People with disabilities and elderly people are the largest minority in the world. Some of these disabilities are not visible. During the corona crisis, this population is at greater risk due to pre-existing conditions or lack of support or facilities that are unavailable during these times. In addition, the staff is wearing protective gear and masks, which can cause stress, anxiety, and difficulty communicating, especially for people with hearing disabilities. You are the first ones they come across at the reception and the first to provide service. Let's learn how to be accessible during the corona crisis. If you notice a blind patient, approach him, introduce yourself, and ask how you can help him. Explain the process and all relevant information. Read all written information as needed. Avoid touching accessibility aids, such as a white cane or a guidance dog. We will not always be able to identify a patient with hearing disability. If the patient is not responding, he might not be able to hear you. Place yourself in front of him, make a gesture with your hand so he will see you are looking for his attention, and try to make eye contact. Usually the patient reads lips and therefore will have difficulty understanding you with a mask. Speak clearly and slowly, but do not shout. Use writing on paper or on your phone and show it to the patient. When a patient with physical disability or an elderly person enters, talk to the patient and not to his or her caregiver. Ask whether he needs help. Enable the presence of a caregiver or family member if needed. Direct the patient to an accessible treatment room with an adjustable bed. Usually it will be difficult to identify a patient with autism or mental or cognitive disability, but please note that during a crisis, these patients tend to feel more pressure, anxiety, stress, and confusion. Be sensitive. Introduce yourself and try to calm him down. Use simple language and short sentences. Remember, providing accessible service depends on you. Act with respect and sensitivity to each patient. It is best to consult with the patient himself on the best preferred way to assist him or communicate with him. For more information and additional tips on accessible service during these times, please see our Corona Times Accessible Service presentation at the following link. Dear Service Provider, together we can make sure the service you provide is professional, accessible, and equal for all.